utilizing stem cells. Unfortunately, it's a lot less than it was in the past, but it's still very expensive to get these type of treatments. Now we can, in my clinic, we can harvest the stem cells from a patient and then send it off.
How long does that process take?
It takes about 2 months, and we take some blood from them, make sure they don't have certain viruses and so forth. And then we grow those stem cells, and I do adipose derived, meaning it's just coming from fat. Now, you can also do a bone marrow, which those are really the only two places you can
Did
get
that
stem
exist
cells.
like 20 years ago or no?
It did, but people just weren't doing it unless they were in the research.
Did it exist like 30, 40 years ago?
Yeah, it did, because that's how we've been doing bone marrow transplants for probably 50 years, probably longer, a lot longer than that.
So my father had to do bone marrow for his older sister. She ended up passing away. I wasn't born yet, but she had leukemia, and then she needed bone marrow from him. He was a blood match. If this was back in 1981, 82, would it have been stem cells still or no?
What it does when you get a bone marrow transplant, to be fair, like I could go right now in your bone marrow and pull out 8 to 10 cc's of thick purple blood, and that's bone marrow blood. And in that would have anywhere from 60 to 100,000 stem cells. And those are great stem cells, don't get me wrong. But when you're getting a bone marrow transplant, that type of blood, because you have to it has to match and everything like that, they would use that to reboot the person's entire system. Using radiation, they would kind of kill their immune system. That's why those people, used to die a lot from infections, because they didn't have an immune system. And they put that bone marrow transplant within them, or the cells that they took, and it kind of reboots that system. And hopefully that you grow those new healthy cells and you don't have leukemic cells.
This is interesting. So you said it reboots. So would that work for, let's say, like current, like modern day, right? How does that apply to modern day? Like, let's say something that's old, that could be possibly eradicated soon. Like maybe HIV was big back in the day. Do you think it could pass through that, or
no? With HIV, it's different, because there's certain components and certain cells of the immune system, and there are very specific cells that are affected with HIV. And so right now we don't have a per se cure, but the medications, like before, all they had was AZT, and it had a lot of side effects to it. And so now they'll keep it down. It's much like the herpes virus. If you have to, there's medications to bring the viral load down to nil, where you can't even test it. Doesn't mean it's gone. It just means you just can't test it. And they can do that with HIV now, but it's not gone.
You know how there's like some things that were complicated in the past, today they could be eradicated or completely transformed. Like, for people who are listening, what have stem cells done that today is like simply, it would honestly help a lot today versus back in the day? It might have been complicated, but like, because of stem cells, we're able to take care of these problems. Like, what are the biggest things it can solve?
Some people say that it's great research. I think it's great research, but some people say, it's not a double-blind randomized study, which they, say it has to be that for it to be working like it's supposed to. Okay. Stem cells now, depending on whether they're adipose derived or if they're from bone marrow, there's been patients that were paraplegic. They can walk now. People that were totally paralyzed or couldn't feel anything, they can slowly
because of nerves
feeling. Yeah, the nerves regenerate, but they regenerate with the regenerative properties of the stem cells.
So if somebody
we didn't know
fell
how to
off,
do that back then. It's just it's just kind of slowly improved over time, and that's what's the most amazing.
but
thing
like,
about
what
it.
if somebody's completely paralyzed, like from the neck down, fell off a balcony?
They're figuring
this out.
Yeah, they're figuring this out, and there have been guys. I mean, in different countries, we can do it here, but it's still under research base. And you definitely can't say, "Oh, this is going to cure this or fix this," because you don't know. Some people, they've tried it on and didn't do anything to. Yeah. But then some people, they've tried it on and they're still trying to figure out why it worked on some and it didn't work on others. And these people were able to slowly learn how to walk again.
So do you think like something like paralysis, like in your professional opinion, do you think something like paralysis is going to be a thing of the past one day?
Yeah, I think it will. I think we'll get better and better with how we can repair nerves, especially nerves in the spinal cord, because that's that's where it is. I mean, if you can repair it in the spinal cord, then that person's going to be able to eventually, it's not going to happen overnight, but will eventually be able to move and walk and feel and such. And so do I think that's a
Like how many years
possibility?
out do you think that is?
You know, it varies because there's been some reports that, you know, they've treated patients with their own stem cells. They've grown them and they've injected intrathecally is where it goes right through the dura of the spinal
Right.
cord,
Yeah.
and then it goes all the way up to your brain. And so they're putting in 100 million, 500 million, a billion stem cells that they've grown. And so some of these people have had some amazing results. Now, they get up after a week and start running? No, but they can move their legs, and then they can slowly, they have to still relearn how to walk, you know, and then eventually to run, you know, and how their legs move. And do I think that utilizing stem cells will eventually, you know, cause us to treat things like this a little bit easier? Absolutely. It's just right now, there's been reports and there's been probably thousands of people that have had some benefit from stem cells. As medical professionals, we say, well, this is anecdotal. This is something that's just, it happened and it's wonderful, but I can't reproduce it. If you can't reproduce it, then you can't just say, oh, this does this. You know, some people have, you know, some people it works great. You'll have 100 people and, you know, 80 will do great. And you're like, oh my God, this is awesome. And then 20, they don't get anything from it. And they're like, but why? Is it something that I gave them? Did I not process the stem cells right? Is it their stem cells? Or maybe they needed something else other than just stem cells? It's hard to say. We
Do
don't
you think
know.
they'll be using it in conjunction with like Elon Musk's
It could. It could
what's
be.
it called? The
Neuralink.
Yeah.
Neuralink's very interesting because Neuralink, it's going to stimulate parts of the brain that can help us to kind of repair ourselves.
Yeah.
Like there's certain people that feel that, you know, just taking care of you know, we should be able to repair everything in our body. And so stimulating certain parts of the brain with Neuralink can allow that person to quite possibly
Is that going to be
heal.
similar to the clear the
Oh, when you're getting
what's it called again? The defibrillator.
defibrillator. No,
Like for your brain, like it's gonna, you know?
I mean, it stimulates, but I hope it doesn't feel like that. I don't know if you've ever gotten. I know you've gotten shocked, but you never got shot like that
in your brain. Yeah.
'Cause that can stop your heart right there. But anyway, do I think that all that stuff is going to benefit us to where, you know, certain ailments that we have now are going to be a thing of the past? Absolutely.
Yeah.
You know, you even bring up different things that work that wasn't in the past, and now in the
Today it's like super
today it's
easy,
working.
yeah.
Those GLPs, peptides.
Yeah.
I think peptides, and as I learn more and more about them, I think that's what gene therapy and peptides are going to be the kind of thing that's really going to, how we're going to be treating people.
Yeah.
And obviously we'll use stem cells. It will become less and less expensive. So people can afford that.
Yeah, like it'll
right
just
now
become
when I
more
do
common.
it still costs a chunk of change for me to do it and grow it, and for the company to grow it, and then come back. And then once it's grown, then I can give it to you in your knee and your shoulder. Yeah. IV, some treatments that I have for patients that have issues with their lungs, we'll give it to them IV because you go through what's called a pulmonary first pass effect. Anything in your vein will go immediate to your lungs.
You could
first.
stem cell through that IV, or
Oh yeah, definitely.
How
And
are
if
they
you-
normally? Are they injected?
Yeah, you can inject with stem cells. You can do anything. You can put them in the spine. You can put them in the joint. You can put them, you know, in the skin. You can breathe them in. I don't know how well that is, but the other thing is IV. IV is probably one of the strongest ones because those cells will know within your body where they need to go to heal whatever your issues are.
Yeah.
You know, and we also use exosomes, which exosomes essentially tell the stem cells what to do. Okay. And some people believe in exosomes more than they believe in stem cells. Either way, both of them together, and they can do a lot of cool stuff.